output, the value of the cardiac output, it depends on the tissue need. Not all the tissue receive the same amount of blood. This we will talk about later, when how much will be distributed. It depends according to the need of the tissue, how much the tissue needs. If the tissue at rest needs less blood. If the tissue at high metabolism, more blood. So there must be a mechanism that readjusts the distribution of the blood in different parts of the tissue. This is, as you see in here, it's a way of, to put a percentage, how much in each part. This is in here, the blood vessels function. Now, we have, you remember, the arteries, capillaries, and veins. The arteries mainly bring the blood from the heart to the tissue, and capillary exchange, and then the veins from the tissue to the main difference, to put it in mind, the main difference between arteries and veins, if you take as a structure-wise, of course, the muscle thickness of the blood vessels. If we take as a function-wise, the arteries, they are the side of high pressure, and the veins are the side of the low pressure. That's why sometimes we say arteries, they are pressure reservoir. You know reservoir? They are a pressure reservoir. The veins are blood reservoir. 65 of the blood in our body present where? In the veins. And the main other difference also, if we take them as a function also, distensibility. How much the artery is distensible compared to the veins, or vice versa. To make it easy for you in the life, the difference, simple difference between arteries and veins, you know the kids' balloon? Why we give it to the kids? Because it's easy to inflate it. They can inflate it easily with less force. The other balloon, the balloon of the football. Balloon of the football, you cannot inflate it, even the adult people. But we need what? We need the pressure. So, a football balloon, you can put small size of air with a high pressure. But a kid's balloon, you can put too much blood with very low pressure. That's how simple example in life, how you differentiate between arteries and veins. The arteries are the side or the reservoir of a pressure, and the veins are reservoir of the blood. That's of a high pressure, this is of a low pressure. This is of a high volume, that's of a low small volume. Clear? That's how you can differentiate between the two. And that's the simple diagram for the vessels. Now, this is what's the fluctuation of the pressure, up and down, systole, diastole, systole and diastole. You remember in the left ventricle how much the pressure, the systolic pressure? It's about 120, 130, 110. What's the minimum pressure? 0, because there is no contraction. So the pressure in the left ventricle is going to the maximum during the systole and going to the minimum during the diastole. Minimum is 0. So there is no pressure in the left ventricle during diastole. So where is the pressure? In the aorta. And you can see, this is the fluctuation. This is the left ventricle, systole and diastole. This is the fluctuation between in the aorta. In the aorta, the pressure is nearly the same as the pressure in the left ventricle. Nearly. Not necessarily, but nearly, because if they are equal, there will be no flow. So if it is in the left ventricle 120, in the aorta must be 119. It is negligible, but there is a gradient. There is a flow. And that is the systole. During the diastole, the pressure in the left ventricle will go to 0, but the pressure of the aorta will reach to about 80. Why it will not go down? Back. When it 120 to 80, this is recoil. What's after that? ما في هذا next beat coming, next extension. So during the cardiac cycle, the aorta dilated, then recoil, dilated and recoil. Before it will go more decreasing of the pressure, the next beat coming and next distension again. That's why there is no, or the pressure in the aorta during the diastolic period is the highest pressure, which is about 80, 85, 75. This is the distension during the systole, recoil during the diastole, systole, diastole, systole, diastole. If there is no coming systole, there will be no more beating, so the pressure will get reduced. That's why if 2 or 3 beats are missing, the patient could fall on the floor because there is not enough blood going to the brain. So systole, diastole, systole. That is how before it goes down in the left ventricle, in the aorta, the next beat coming and distended again. Now. ما هو ابني مش قلنا isovolumic relaxation of the muscle. The blood which is staying in the left ventricle, it's staying in between the trabeculae, in between the chorda tendini, in between the papillary muscles. You can say 1 millimeter, 0.5 millimeter, whatever, but it is from the force, from the point of the force of the left ventricle, there is no force. So there is no pressure. Here? Now, and then if you go, so highest pressure in the ventricle and aorta, then large arteries, small arteries, and then until will be the minimum pressure in the right atrium, which is nearly to 0. Now, if we talk about physics, the flow is equal to, the pressure is equal to flow by resistance. So, what they are? Pressure, you know, force. Flow, blood flow. Resistance, what's the resistance? The pressure here, it's generated in the left ventricle, and it's related to the volume of the blood with the resistance. So, you know the pressure, okay? And we can measure the pressure. The flow, it's simply liter per minute or milliliter per second. So again, we know the flow. But what is the resistance? You see, to make it, and again, a simple example, this is a table. The left ventricle pushes the blood where? To the vessels, to the aorta and the vessels. Now, imagine I want to push this. This is made of wood. What do I need? I need force to push it. Now, if this is changed into steel, what do I need? More force. But if this is changed into plastic, you need less. So, what's in here, what is in front of the left ventricle, هو resistance. You cannot define it, but we cannot measure it, but we can predict it. If we know the flow and we know the pressure, then we know what's the resistance. So, where is the resistance? You have a large artery, or aorta, large arteries, small arteries, arterioles, so on. Now, each artery will be divided into so many. And the least diameter where? Now, if you go in as an example of here, this is a pressure. And this vessel is distributed. flow and the pressure. So the pressure and the volume, from the large one, it will be distributed to these vessels. So the flow and the velocity and the pressure will be reduced. In which way? When you take a vessel, any vessel, the flow near the wall, why? Because of the friction. So the next layer will be a bit higher, and then higher, and then higher. Now, where is the maximum?
In the center.
In the center. So this is the way of it will be. This is called laminar flow. Laminar flow. Again, a good example of that, إذا تاخذ بربيش المية الهوز of water, and you open the water is there, and you cannot hear anything. You see the water flowing. Now imagine if you squeeze the vessel. You apply pressure, then this will be. So what happened to the flow now? It's going in this way, in this way, in this way. So in all directions. This is called turbulent flow. So we have a laminar flow and we have a turbulent flow. Keep in mind, always when there is a turbulent flow, there will be sound. If you imagine the hose of water, when you squeeze it, this is the principle. Normally, in our life, or in the human body, normally, supposed to be there is no turbulent flow. But for a reason though of the other, if the turbulent flow develops, it will produce sound. And that is when there is a renal artery stenosis, when there is an stenosis in the valve of the heart, it will cause turbulent flow. And then we will hear murmurs, abnormal sounds. First sound, second sound, and in between them. That is abnormal because of the turbulent flow, because of the constriction, stenosis. Now, the mechanism that will cause the turbulent flow, it's called the Raynaud number, RE number. A Raynaud number, it depends on the velocity, on the diameter, and on the density. And again, in here of the viscosity. So this is velocity. This is diameter of the vessels. And this is the density of the blood. And this is the viscosity of the blood. When this Raynaud number more than 200 to 400, this will cause turbulent flow. So Raynaud number is the tendency of developing of the turbulent flow, which will cause sounds. Sometime, in some cases, this Raynaud number can reach 4,000, 2 to 4,000. This is significantly when there is a severe aortic stenosis, when there is a severe stenosis, which can cause that. But at any time when there is Raynaud number more than 200 or more than 400, let us say, it will cause the. So it depends in here on what. It's directly proportional to what? To velocity and the diameter. And inversely proportional to the viscosity. You got the message? ايه مش بالضروره يصير velocity could be increased but not necessarily because atherosclerosis, if there is stenosis in one part, yes. If you have a stenosis in here, this will cause turbulent flow. But if you have atherosclerosis, which will affect the walls in here, it's not a particular lesion. And When you have a vessel, small vessels, in atherosclerosis, you remember normally they are not developed in large arteries. Mainly they are developed in small arteries. So you are not reaching to the small arteries by your stethoscope. But when you have aortic stenosis, renal artery stenosis, carotid stenosis, when you put the stethoscope, you can hear them. But small vessels, you cannot hear them. You cannot reach them actually. The arteries now. نعم. راينولد نمبر، العالم اللي اكتشف هذه اسمه راينولد. يعبر development of the turbulent flow. Tendency for development of the turbulent flow. This is again I will explain to you in the heart sounds how and what's the significance of that. At any time we have turbulent flow anywhere that will cause or that will give us turbulent. It will help us for diagnosis. When we have aortic valve disease, mitral valve disease, pulmonary valve disease, we have renal artery stenosis, carotid artery stenosis, femoral artery stenosis, and so on. We can make diagnosis of that. Now, when كل ما يزيد البوسيبيليتي زي الايورتا بالايورتا الدايمتر is high, so there is a possibility of turbulent flow. But the turbulent flow, as I said, minimum, which is somewhere around the 400, not necessarily to cause the sound. Mostly the turbulent flow which develop because of stenosis, because in Reynolds number it will be more than 2,000, so it will cause the sound. Now, ما في شيء. There is no turbulent flow. That's laminar flow. When you have a laminar flow, there is no sound. I will explain to you in the next lecture. Now. لا من يزيد you see من يزيد ال diameter ال flow as in case of the aorta. من يصير ال vessels, very small vessels or reduce the vessels. Most of the blood will be in friction in the wall. So it is laminar flow. It's not turbulent. Turbulent flow, it will go in all directions. في stenosis. نعم. لا density تختلف عن ال viscosity. Wait. روح اقرا الفيزياء وتعال قل لي انا مو فيزيائي. بس this is what's supposed to be in medicine. انا متاكد انه هذا اللي انت تقوله it's not in the way you like. Go to physics. في اللي بده يفهم كثير عن هذا الحكي في كتاب اسمه medical physics. As I told you, 70% of our functions in our body هو physics. So if you want, you can read a small book. It's called medical physics. Now, that's what's related. So how we can measure the flow and the pressure. We know the unit of the pressure. We can measure the flow, and we know the unit of the flow, and then the resistance. We cannot measure it, but we predict it. We measure this, and then the resistance. Normally, we put absolute number without units. If we want to put units, we have to put the units of pressure and the flow, all of them. But normally, we don't put units. And it's called peripheral resistance. Is one, how it is. If الريزيستنس قلنا البريفيرال ريزيستنس واحد اللي هي شو تساوي؟ pressure by flow. مش هيك؟ نعم. If you take the pressure in the cardiovascular system as a whole, starting from 120 to reach until to 0. 120 is not the average pressure, it's the maximum pressure. But the average pressure is between 120 and 80, which is somewhere nearly, I'll explain to you again, could be in the next 2 lectures, nearly about 100. The average, not exactly 100, but nearly to 100. Clear? The cardiac output is about 5 or 6 liters per minute. So we have the average pressure of how much? 100. And the flow, cardiac output is about 6 liters per minute. If we take it by seconds, how much? 6,000 by 100. Sorry, by 60. So again you have 100. That's why the peripheral resistance is 1. You can put the unit of millimeter mercury per liter per time. But usually we take the peripheral resistance and absolute 1. And the difference between pulmonary resistance and the peripheral, this is peripheral resistance, and the pulmonary resistance is only about 14% of peripheral resistance. So it is 0.14. This peripheral resistance significantly increased in patients with atherosclerosis. How? Now, where is the resistance actually? احنا لسه ما قلنا where it is. This is the aorta, let us say, divided into large arteries. And this artery is divided into medium-sized arteries. And this will be into small arteries. And then into arterioles. Okay? So the pressure here is going to divide for this. And then in here divided in this. And in here will be divided in this. So where is the large number? And as we know, the smallest the vessel, the more is the friction. So the more is the resistance. When the diameter reduced, the friction more, because the blood, which is most of the blood will be in friction with the wall. So where is the resistance now? And the arterioles. Mainly because they are the largest number and they are the smallest number. Capillaries, if you مش أخذتوا histology ولا لسه أخذتوا histology. The capillaries, they are single cell vessel, single cell. So there is no resistance. Nothing, no resistance at all in the capillaries. Just because what do we need in the capillaries? We need a very short distance between the blood and the tissue. So for exchange. So there is no resistance in the capillaries. There is some resistance in the vein, but there is no resistance in the, and again, the pressure in the capillaries is higher than the pressure in the veins. That's why the flow is lower. And again, we will talk about. So you got the message, the peripheral resistance where mainly in the arterioles. And in the patient with atherosclerosis, should be here. More friction, more resistance, more pressure. That's why patients with the age, they develop hypertension because of a high resistance. Because of why? Because atherosclerosis, deposit of cholesterol and fat in the wall of the blood vessels, distensibility will be less, so resistance high and the pressure is high. That is the mechanism. So avoid to eat fast food. You see, this mechanism, I'm sure pathologists, they explain to you, this atherosclerosis process, it's not developed in the adult. It's starting from the childhood. It takes time to develop. So you have to be sure or care about yourself and your kids in the future. The food which we are eating, it depends on how our family give the food. It's different from one community to the other. But it depends on what we start to eat in the childhood. And the worst food in life, well, fast food. I don't want to mention names, but if you want to be sure what's that type of food, buy one piece, whatever it is. Don't eat it when it is hot, flavor. It's Very nice. Leave it for 1 hour and then open it and look at it. Believe me, you will never eat it again. So fast food is started from the childhood. Atherosclerosis, it takes time before it develops. That is my only fast food has said. Now, so you got the message, the peripheral resistance, the pulmonary resistance, the friction, where is the resistance and how the pressure increase and so on. Clear? Now, لأنه single cell بنتي ما في wall الwall مالها just one cell. لا بنتي اسمعيني بس مش بس ال diameter of the vessels but الwall of the vessels even احنا قلنا الveins but still the wall فيه some fibers. والفرق قلنا بين هذا وهذا this is a very thick and this is very thin but not as thin as one cell. نعم مش عشان لا it is just single cell. ما في muscle ما هو تقول ما في muscle fibers ما في fibers in the wall so there is no resistance in the capillaries. Here now this is what if you want to take the flow you have to differentiate between flow and velocity. لا يا ابني يا انتوا تحكوني انا يعني. You have to differentiate between flow and velocity. Flow is volume per time. Velocity is distance per time. So there is a quite difference between the two. The flow اللي هو cardiac output. The flow of the blood, when we say it is 5 or 6 liters, all of 5-6 liters going where? To large arteries. All of them 5-6 liters going to the small arteries. All of them going to the capillaries. All of them. So the flow rate is the same in all the cardiovascular system. Flow rate. But not in each vessel. Of course, we say it as an arterial system, capillary and venous system. 5 liters will pass in the arteries, 5 liters will pass in capillaries, 5 liters will pass in veins per minute. When we take the velocity, very high velocity in the aorta and very slow velocity in the capillaries. Why? It's related to the service area. What's the service area? If you open the vessel, okay, and open it. Take the service of that. This is called the cross section or service area. So the velocity inversely related to the service area. The least area where? Area. And the aorta. And the highest area in the capillaries. So the highest velocity in the aorta and the least velocity in the capillaries. That is how you relate between the flow, velocity and service area. This is again, we'll show you in here. This is the capillaries with a very high service area and very low velocity. This is the aorta with a very small service area and very high velocity. This is how you can, this is the arterial system and that is the capillary. Very maximum or very large area and very low. If you in some books you will find out that the service area of the capillaries it's equal to the service area of football yard, ساحة قدم. So imagine that 5 liters coming to the arteries and that 5 liters will distribute in that area. So imagine how big the area is and how much flow. Why we need that? Because we need it for the exchange. And again, we will talk about the microcirculation, about the capillary circulation. Clear so far؟ حد بده يسأل؟ متى ما تبون تاخذون راحة قولوا لي. الساعة كم هسه؟ بعد 10 إلا 10 في تايم so okay. Now, this is the principle of laminar flow and the turbulent flow. So far you know the resistance, flow, pressure, cardiac output, and where is the resistance? Okay? Again, if we go to physics, the pressure is equal, the flow is equal to, there is a formula which is called Poisson's formula in physics. This is the pressure, radius 4, again. This is the constant, this is the pressure difference. And then this is the diameter or the radius of the blood vessels. This is constant, this is the length, and this is the viscosity of it. If we take all of these, you see, this is the pressure gradient. How much we say the pressure gradient, roughly? From 100 to 0. It is nearly normal. It's nearly not changed. Okay? If we take the length of the blood vessels, the length of our blood vessels is constant. It's not changed. And the viscosity of the blood normally it is constant. So which factor is variable here? It's only the diameter. And the diameter is mainly because of the vasodilatation, vasoconstriction. Vasodilatation, and it was found by experiment. The flow is equal to the diameter to the radius to the power 4. That means what? If you have a diameter of 1, so the flow will be 1 by 1 by 1 by 1. If you have of 2, then 2 by 2 by 2. If it is 4, 4 by 4 by 4. So imagine in here, a diameter, we increase the diameter 100%. From 1 to 2, 100%. صح? Double. But the flow increased 16%. That means 16 times. That is 1 time, this is 16. Instead of you double it, in here you have 16 times. So the flow, it is related to the power 4 of the diameter of the blood vessels. So the main factor, which is variable factor, to regulate or to change the flow in the blood vessel is what? The diameter. Yes, we need the pressure gradient, but the pressure gradient by itself is a factor. It is a factor. But the main factor is the pressure. When the pressure increases, will cause dilatation. So the diameter of the blood vessels is the most powerful variable element which change the blood flow. And that's why during the vasoconstriction, we have a severe constriction of the muscle fibers and vasodilation dilated of the blood vessels. And this is, as I said, where it's again in the books. So, I mean, when you go to the chapter and you will read, they will, yes, it is simple way to read, but it's a lot of things too. If you understand what I am talking to, it is simply, you go to the book. Yes, read the book, because you have to know how to find out the thing from the book. If they ask me for the exam, I'm willing to give you the book during the exam. And then give the questions accordingly. If you don't know where to find out, you will lose your time. So the idea, it's better when you will be a doctor in the future. It's better if you forget the name of the medicine or the complication. It's better to go to the book rather than to make a mistake. But the exam here is not like that. So when you read, please go and read the book. Find out. It is bulk, yes, but you have to read it. To read, at least not all of it, but to read. And how you can, what are you going to take a decision about something. If you don't understand, put notes. خلي ملاحظة وتعال اسأل. So, clear? You know the Poisson's law? You know the P, the flow, and the resistance, and you know the Reynolds number. Now, كله هو normally it's about in the resting time. The cardiac output is about 6 liters. So 6 liters per minute. If we divide it by 60 اللي هي in second نطلعها تطلع 100. Okay? The pressure, it is always going from the maximum of 120, but 120 is the maximum. We have a range. We have what's called mean arterial blood pressure. I will explain to you again in the future. Mean arterial blood pressure is the average of a pressure between the systole and the diastole. Average. It's roughly, it is not 100, but it's roughly near to the 100. So when we divide 100 by 100, we get 1 as a peripheral resistance. This is under resting condition. With the exercise, of course, this will be changed. Now. Yes. شلون؟ الدايمتر راح يقل. وعلى yes you are right. صح. صح. تأثير على ما هو نفس الشيء هو بنتي الفلو قلت because the diameter, the more you reduce the diameter, the flow and the resistance is the same. That's why in patient راح تسمعين بالهايبرتنشن في complications. شو ممكن يصير؟ high pressure وفسل low resistance ممكن يصير rupture. سامعين واحد يقولون عصب وانجلط because rupture of vessel in the brain ويصير جلطة بالدماغ ويصير شلل because of the less resistance, less flow and high pressure. ها؟ high resistance. ما قلت لها high resistance. قلت له غلطان. نعم. Clear? Now, you will take 10 minutes and then we'll come to the next one.